Bonjour tout le monde, good afternoon. Je m'appelle Eric Leclerc, my name is Eric Leclerc, and I'll be moderating this session today. So thank you for joining us for today's media availability on the novel coronavirus, or COVID-19. Merci beaucoup de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus, le COVID-19. Before we begin, I'd like to go over a few items. So a reminder to please place your microphone on mute until I invite you to speak or to ask your question. That'll allow us to keep a quieter environment so that we can hear the question properly and of course importantly the response. To view who is speaking on Zoom, you can put your view on speaker view instead of gallery view, and the button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing some remarks from Dr. Vera Etches, the Chief Medical Officer of Health, la médecin-chef en santé publique, and Councillor Keith Eglai, Chair of the Ottawa Board of Health, le président de notre Conseil de santé d'Ottawa. Following the remarks, we will then take questions from members of the media. So let's get the show on the road here, and I would like Dr. Etches à prendre la parole, donc je demande à Dr. Etches de prendre la parole.
Good afternoon, Quay. Bonjour tout le monde. So Ottawa Public Health continues to see a higher number of positive COVID-19 cases in Ottawa than we had been seeing in the previous months. We had anticipated an increase in cases as a result of opening businesses and other sectors of the economy, but these numbers are concerning. They don't appear to be linked to the implementation of stage 2 and stage 3. Rather, what we're seeing is primarily linked to our social behaviors and indoor gatherings. So it's all age groups under age 80 have had at least a 5-fold increase in the rate of COVID infections since the first week of July. So sadly, this has included the first death that we've seen in a while, and this was a person in their 40s. En revanche, ce que nous observons est surtout lié aux comportements sociaux et au rassemblement à l'intérieur. Depuis la première semaine de juillet, on note un taux d'infection à la COVID-19 au moins 5 fois plus élevé dans tous les groupes d'âge de moins de 80 ans. Et là, cette semaine, nous avons appris le premier décès d'une personne dans la quarantaine depuis un mois. So we are able as a city to move into stage 2 and then stage 3 because of safe practices and good choices that we've had to make in recent months. So Ottawa residents do know what it takes to keep the transmission of the virus as low as possible as we resume our activities. We need to get back to work and back to school, and we need to find a way to have a balance between what are acceptable rates of increase in the COVID infection, along with resuming the functions that are so important to our well-being and our health. Socializing with loved ones, visiting loved ones, accessing services, simply moving about in our community. We need to do these things. But today I'm asking people to get back to the basics. So as we go about doing these things, practice physical distancing. Please stay home when you're sick. Always wear a mask inside while you're in public spaces and even outdoors when physical distancing is difficult. Don't forget to wash your hands, avoid touching your face. We've flattened the curve before, and I know Ottawa has what it takes to do it again. Aujourd'hui, je demande donc à tout le monde d'en revenir à l'essentiel. Pratiquez la distanciation physique. Veuillez rester chez vous si vous ne vous sentez pas bien. Portez un masque lorsque vous vous trouvez dans l'espace public à l'intérieur, mais aussi à l'extérieur si l'éloignement physique est difficile à respecter. Et n'oubliez pas de vous laver les mains et d'éviter de vous toucher le visage. Nous avons réussi à planir la courbe avant et je sais qu'Ottawa a tout qu'il faut pour y parvenir à nouveau. It is important to know that the number of cases we're seeing today really represents the actions and decisions that were made 2 or more weeks ago. So today, I'm asking people to look ahead 2 weeks and challenge yourselves. Think about how we can, have a better picture 2 weeks from now. This is the time where we're wanting to aim towards zero, and let's change that trajectory together. Want to make a few comments on the reopening of childcare services. So recently, we've seen outbreaks in 4 childcare centers in Ottawa. So the process is when Ottawa Public Health is notified of a confirmed case in a COVID-19 in a childcare center, we connect with the center, the cases, the families. We determine high and low risk close contacts, and we provide specific guidance and information about what those families and those children need to do. People need to daily monitor, and high risk close contacts are required to self isolate and to get tested at least 5 days after that initial contact with the case. We review infection prevention and control measures to assist with the case and contact investigation. And all the while, we're continuing to promote practices that prevent entry of COVID-19 into childcare settings. You know, these processes are similar to what we would do in schools, and I know that may be of interest for discussion today. When we each do our part to limit COVID-19 transmission. We help keep COVID-19 out of daycare. So it's linked. My previous comments about going back to the basics. The more transmission there is in the community at large, the more risk there is for COVID-19 to be introduced into more vulnerable populations. We need daycares and schools to reopen as safely as possible to support children's health and development and to allow parents to get back to work. Si nous nous employons tous à freiner la transmission de la COVID-19, nous contribuerons à prévenir sa propagation dans les services de garde d'enfants et dans les écoles. Plus la transmission augmente à l'échelle communautaire, plus on risque d'y introduire la COVID-19. Les services de garde doivent réouvrir de la manière la plus sécuritaire possible pour contribuer au développement et à la santé des enfants et permettre aux parents de retourner au travail. I want to emphasize the importance again of socializing more safely. So COVID-19 is still in our community, across all neighborhoods, all age groups, and this recent uptake in cases is a clear reminder of what can happen if we let our guard down, especially when visiting with friends and family. So being with loved ones feels good, it provides comfort, it makes it easier for us to let our guard down, but we need to protect those that are closest to us in the same way we'd protect a stranger in a grocery store. It's maintaining that 2-meter distance and wearing a mask when we're indoors. So if you have a cold, flu-like symptoms, COVID-19, some other infectious illness, it is important to stay home, not socialize or work until you're symptom-free. It is recommended if you have these kinds of symptoms that you get tested for COVID-19. So make sure your social circle then consists of the same 10 people. That less is better. And if you plan to visit with people who are not in that direct close contact social circle of 10, do the visiting with physical distance and preferably outdoors. Veillez à ce que votre cercle social se compose des 10 mêmes personnes, voire le moins possible. Si vous prévoyez rencontrer des gens qui n'appartiennent pas à votre cercle social direct de 10 personnes, faites de préférence en plein air et respectez la distanciation physique. Also, maybe introduce a new point that I haven't emphasized before, and that's that a negative COVID-19 test result is not a guarantee that you're not infected. It takes about 5 days after exposure for a COVID test to detect the virus. and you might be exposed to the virus after the test has been taken. Un résultat négatif au test de dépistage de la COVID-19 ne veut pas nécessairement dire que vous n'avez pas contracté le virus, puisque ce test ne peut le détecter qu'environ 5 jours après l'exposition. Therefore, you should always remember, again, the basics about being COVID-wise, being diligent about wearing masks, physical distancing, and hand hygiene, even after getting a test. Getting tested for COVID-19 is not a free pass to let your guard down and forget these important measures that will decrease COVID-19 transmission. Finally, comment on stage 3, businesses reopening. Many more businesses have opened their doors. They're making significant efforts to do so more safely. They need your help. Please adhere to public health guidance when visiting your local businesses. Furthermore, since it's difficult to maintain distancing while seated at the same table in a restaurant or bar, really should only sit with members of your household or that exclusive social circle of up to 10 people. So Ottawa Public Health is working closely with several business improvement areas, community partners, and the City of Ottawa partners, including bylaw and regulatory services and planning, infrastructure, and economic development, to promote practices that reduce the risk of COVID-19 transmission. Ottawa Public Health considering all possible measures to support wise choices and practices during stage 3 reopening of restaurants and bars in the city. I am writing further instructions to businesses this week to require them to prevent people from coming to work sick, minimize opportunities for transmission, including reducing close contact with others, and record keeping to support the efforts of contact tracing, among other practices. So information from businesses will continue to be updated on our website. Keeping transmission of COVID-19 virus in our city low will allow children and youth to return and stay in school, more people to return to work, residents to access important services, businesses to keep operating, and our economy to return to some more support for all that we need to do. Every single one of us has the capacity to make a difference. The future is in our hands, and we can do this together. So thank you. Merci, Miigwech.
Merci. Thank you, Dr. Etches. We'll move on now to Councillor Keith Eglai, the chair of the Ottawa Board of Health. Donc, la parole est à vous. The floor is yours, Councillor.
Good afternoon. Bonjour. Kwe. Recently, our city has seen a concerning increase in the number of COVID-19 cases. Ottawa Public Health confirms that since the first week of July, there's been an increase in cases in every age group under the age of 80. As the community continues to gradually reopen, we must remain cautious and care for each other. We have seen examples in other cities across the world about the potential for this virus to spread if it is given the chance to do so. Now is the time for us to act. We anticipated some challenges along the way, and it's been a long journey since the pandemic was first declared. Now is not the time to let up on our efforts. Looking forward to schools reopening in the next few weeks, it is especially important that we remain vigilant. We can't forget that the virus is present in our community, and the vast majority of us are susceptible to infection. We all need to continue to be COVID-wise to prevent transmission. We are urging residents to hear the message from Ottawa Public Health and act accordingly. Please practice physical distancing. Wear a mask indoors or wherever physical distancing is not possible. Wash hands, stay home when you are sick, and keep your same social circle. If you must attend a social event with individuals outside of your circle, please keep in mind that it's safer if the event is outdoors and the physical distance is maintained. Dr. Etches referred a little while ago to a 2-week period, and I would suggest that we all take the 2-week challenge. We start today and we look at what we've got going ahead of us in the next 2 weeks and look at how we can do that in a COVID-wise way. And the more that we get back to basics, the more that we wash our hands, keep our physical distancing, and wear masks when that's not possible, we'll make that a successful 2-week challenge. So ask all the residents of Ottawa to consider this 2-week challenge and take it on in an active, collaborative way with your neighbors, your friends, and your family. If we each do our part and make it a community effort to limit the transmission of COVID-19, our daycares and our schools will be able to reopen safely. Our children will be protected, parents will be able to get back to work, businesses will be able to remain open, and ultimately, we will save lives. So thank you everyone for all the hard work you've done so far. There's more hard work to be done. I know we can do it as a community. I know we can do it collaboratively and cooperatively together. So I urge you to do so, and I believe we can get it done. Ottawa, let's do this together.
Thank you. Merci beaucoup, Conseiller Egli. So now, in the interest of time, I'll quickly read through the list of media who have registered. So there's no need to indicate if you are present. However, if I missed your outlet and you're not on that list, please speak up after I'm done, and we'll make sure to add you to the queue. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. So here I go. 1310 News, CBC, CTV Ottawa, Global News, Le Droit, On the City from the Burbs, Ottawa Citizen, Ottawa Sun, Radio-Canada, TVA, Gatineau, Ottawa. So have I missed anybody? Have I missed an agency? Okay. If you do join and you want to drop a message in the chat, we'll pick it up there. Now I will invite each agency in alphabetical order to ask their question. And as you've heard from the list, there are a number of you, so please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. All right, so let's get going. We're going to start our first question. 1310 News. Who do we have on?
Hi, it's Chris here.
All right, go ahead, Chris. Your question is to?
Question is to Dr. Etches. I wanted to get your reaction to the Ford government's recent back-to-school announcement, knowing that while elementary students are going to be back to school full-time, as was your recommendation, they're also going to be going back with full class sizes. So can I just get your reaction to the recent announcement?
Thank you. I actually haven't been able to read the report and go into all the details. I'll want to do that and be able to comment more fully afterwards. But I think it is in line with what I was hoping to see, which is a balance in the approach to children's health and well-being and what families need. So I do appreciate that they're looking at children being in school 5 days a week, and especially the younger ones. So I think those are encouraging measures that will help us have the things that we need to be able to go forward. And at the same time, we know that people are concerned about COVID and all that can be done to keep COVID out of schools. So I gather there's some interest in bolstering the capacity for public health to work with schools. We will continue that. We are engaged all the time with these preparations to make sure that we can keep COVID out of schools and we can respond quickly if we need to. So I think, I don't know if that answers your question, but.
Yeah, no, it does. Thank you. And just as a follow, you mentioned that it's our social behaviors and it's not really linked to stage 2 or stage 3, these recent spike or plateau of cases. How do we get the message out there that these super spreader events, like these COVID parties, are simply just not okay? Is there any option of potentially increasing enforcement or rolling back on some making bars by appointment, these types of things? How do we go about this from now on?
Yes, I think that we have to continue some targeted communications, trying to provide more clarity in different ways to different groups, looking at different channels for different age groups, different languages. The the challenge, I think, is with stage 2. It was more the message of you can gather in groups of 50 indoors. That wasn't clearly conveying that is a risk. That it's meant to be done with distance when they're not people in your group of 10 that's close contact. So I think providing more clarity that this idea that large gatherings are okay is not really uh, true. Large gatherings are riskier, and if you don't have to have large gatherings, then that's best to avoid. And the idea that somehow it's other people or people I don't know versus those people who you have in your home, it is actually the people you have in your home in close contact that are the source of transmission. That's how transmission occurs. So we need to keep describing that, and we'll convey that as we best we can. Um, the idea that it's the bars or a particular place of work is problematic, because that takes the attention away from each of us and our daily behavior, which is more what will protect us or cause transmission. When you think about it, a bar that's doing all they can around physical distancing is a safer environment than a house party. So I think we just want to encourage people to choose the lower risk activities. It's a bit of a harm reduction measure. If you're going to socialize more safely. These are the kinds of things we need to emphasize right now.
Thank you.
All right, thank you. Thank you so much for your question, Chris. So we'll move on now to CBC. Who do we have on CBC?
Hi, it's Natalia Goodwin with CBC. Thanks. For Dr. Etches, in terms of the back to school plan, I know that you haven't had a chance to read the entire briefing, but we're hearing from several parents that are very nervous about sending their children back. What would be your advice to them? Is it safe? What would you say to them as they're thinking about this going forward?
I appreciate the concerns. People have seen what COVID can do in terms of, when it first entered our community, we saw significant, terrible outcomes in long-term care homes and the death. We want to avoid that. What's reassuring is that isn't what we've seen in younger children. That younger children's it's been borne out across the globe, have more mild illness for the most part. There's always a risk in younger people of something severe. So appreciate that concern. It really is parents can do their part by making sure they're physically distancing from others, and collectively, all of us in the community, parents, grandparents, all of the adults, if we keep distance between ourselves, that breaks chains of transmission. It makes it safer for the level of illness in the community that then could be introduced into schools. We do need to take a different approach to staying home when sick. So previously, mild illness, no fever, kids got lots of energy and is happy to run around. That child might well go to school even with a runny nose. And now we're saying no. We don't want any symptoms of illness in any children, workers, teachers in schools. So parents can contribute to really strict screening around that, and we'll be supporting schools as well to make sure that screening is really robust. It is not possible to make schools completely safe. We can't guarantee that COVID will be kept out of all schools. And so we also need to have the response capacity, if there is a case in schools, to be able to quickly identify the close contacts, quickly make sure that people who have been in close contact are home, and that they have the appropriate follow-up, whether it's testing or other supports.
Okay, thank you. And just as a follow-up on stage 3, just as a general question, how do you feel we're doing? You say that you're, going to be putting out some more information to businesses. What are you not seeing that you would like to be seeing from those businesses?
Right. So we are going to, over the next week or two, be in a place where we can start to see whether reopening of more businesses has contributed to an increase in COVID in our community. We still haven't been able to directly link that yet. And what we're doing now is we're trying to do all we can before we get into a place of seeing outbreaks, to really bolster the efforts to prevent transmission by emphasizing the distance between people. And so one of the things we're seeing, we're working with businesses to tackle is, it's actually outside of businesses more so, the lineups where people aren't keeping 2 meters between each other. That is something that we know we want to avoid, and so that's part of it. We also are looking at the same kinds of measures that have been discussed in Toronto around making it easier if we do have to follow up with contact tracing, so that we have records of who's been in the restaurant or the bar when people are seated, that we can have those records. I think the province, I gather, also maybe helping with some direction on some of these areas now, which is good. These help us, be able to respond, but the distance between people is really what's key. That helps us to prevent the transmission. So we're writing, letters to emphasize some of these measures again for businesses that are open.
Okay, thank you.
Thank you for your question, Natalia. So moving on to CTV Ottawa. Who do we have from CTV?
It's Josh.
Josh, the floor is yours.
Thank you. My question for Dr. Etches with back to school, and I know you haven't read the full plan yet, but I'm just wondering if you support the idea of full class sizes with 25, 30 kids in an elementary school come the fall, or do you think the government should have looked at ways to split up the kids so you don't have as many kids in a classroom?
So I'm not an expert in running schools or school boards. I have to appreciate that the Ministry of Education is trying to balance multiple different factors, and so I've given my advice that we need kids in school. If this is the way they can make it happen, I appreciate that. Is maybe perhaps what they've had to do. I'm still looking. I'll look at those details, and we'll be supporting school boards and individual schools, school by school, to make sure that we can minimize the mixing of children and keep those cohorts and those class sizes as small as possible.
Thanks for your question, Josh. Did you have a follow-up?
Yes, I do. Also for Dr. Etches. I know you can't comment on specifics, but the Ottawa Public Health report shows a teenager was admitted to the ICU over the past week. How concerning is it for you and for public health to see that not only a rise in cases among young people, but we're now seeing a more severe case where somebody needs to be hospitalized?
It is concerning. It is this rate, this doubling of the cases between last week and the week before, that was doubled from the week before that. That doubling of cases cannot continue. That will take us into territory that is going to overwhelm our healthcare system and going to result in outbreaks in schools, daycares, long-term care homes. So I'm concerned. I do want to send a message to the public that we need to change that trajectory again with our behavior, all of us. I think I mentioned earlier, it's rare that children and youth have severe illness. We still have not seen a hospitalization in anyone under age 10, but it can happen. And so the more we do to keep the level of the virus low, the less we will see these cases among youth that are more serious.
Thanks for your question, Josh. We'll move on to global news. I believe it's Craig Lord that's on.
Yeah, that's correct. This is another question for Dr. Etches. We've got the long weekend coming up again, and we have probably more socialization coming. I'm wondering if we're looking back to Canada Day, did Ottawa Public Health identify any spikes related specifically to socialization over Canada Day?
We've noticed this rise in cases has followed the beginning of July. So it's hard to say that that's linked specifically to Canada Day events. You know, what we're seeing is still 25% of the cases that arise across our community. People can't really point to where they were exposed, so they aren't aware that they've been in contact with someone who was sick, or in a setting where there was a higher risk. So that is a concern, absolutely, with a long weekend coming up again, that people are mixing a bit too close to each other, maybe indoors without masks, and they could unknowingly be exposed to the virus. It's a good time, again, to remember that this virus is tricky. You don't always know when someone close to you has COVID or not. What will stop you from getting infected is keeping that distance, washing your hands, not touching your face. It's the basics. But that is a challenge with this virus. We need to maintain these behaviors until we have protection, ideally from a vaccine.
Follow-up question, Craig?
Yeah, just about a little bit about schools, but also daycares. We've seen a lot of them are implementing screening protocols, and I want to ask you specifically about temperature checks before people are entering schools or daycares. How confident can we be in temperature checks as a screening protocol to potentially alert us to someone who might be experiencing early symptoms of COVID?
Unfortunately, temperature checks won't catch all COVID infections. I've been looking at the symptoms that appear among children when they have a COVID infection, and fever is not, the top presenting symptom. People may just have a headache. The cough is important. Whether people have a fever or not. If someone has a fever, that's clear. They shouldn't be in school. But often people may have a sore throat or other mild symptoms, and so just paying attention to temperature alone will not keep COVID out of the classroom. So we need to have a broader look at the symptoms and do screening beyond the temperatures.
Thanks very much.
Thank you, Craig. Maintenant, on se tourne vers le droit. Je crois que c'est Julien Paquette qui est là.
Oui, c'est ça.
C'est à toi, Julien.
Merci. Docteur Etches, donc, on le répète depuis plusieurs semaines, les cas que l'on voit quotidiennement, c'est souvent un portrait de ce qu'on aperçoit il y a 10 à 14 jours. Est-ce qu'on a, depuis l'avertissement qui a été lancé par le Dr Mullockney la semaine dernière, est-ce qu'on a des indications que la situation avec les regroupements de plusieurs personnes, ça s'est amélioré, que le message a été entendu?
Oui, je voudrais mentionner que c'est plus les activités sociales qui donnent le risque maintenant pour la transmission de COVID-19, plus que la situation dans les entreprises, les restaurants ou les bars. C'est vraiment les activités à l'intérieur, dans les lieux privés, avec nos proches. Alors, c'est plus l'idée que COVID n'est pas ici, mais COVID est toujours ici, toujours là, partout la communauté. C'est pas juste dans certains quartiers, c'est important de reconnaître que la protection pour nos proches est importante, juste comme la protection pour les travailleurs dans les entreprises. Alors, c'est important avec le stage 3 de reconnaître, oui, il y a des lieux avec un risque plus élevé, Et c'est important aussi d'utiliser les masques, les choses comme ça peut réduire le risque. Et on verra peut-être une augmentation dans le nombre des cas encore la semaine prochaine ou après quand on a le temps de voir les résultats de stage 3. Mais pour maintenant, c'est vraiment un message pour toute la population concernant notre socialisation, qui est important, mais juste faire la socialisation avec distance.
Oui, Julien, c'était un suivi là-dessus.
Oui, tout à fait. M. Iglay a mentionné un défi, un challenge pour une durée de 2 semaines. J'étais curieux d'en savoir un peu plus sur qu'est-ce qu'on invite plus précisément les gens à faire pendant ces 2 semaines-là. I don't know if Mr. Iglay, you want me to repeat that in English or?
That would be appreciated. Thank you.
Okay.
I caught part of it, but not all of it.
Okay, perfect. I was just curious. You mentioned a 2 weeks challenge, and I was curious to know what do you invite people to do during those 2 weeks? Precisely?
Well, I think it was based on something that Dr. Etches had said, but the lag time, if you will, is generally 2 weeks between when someone is exposed and when we start to see that impact in the community. And it seems to me that, you know, we've said from the beginning that this is not a sprint; it's a marathon. And if there was a way to break up our response into bite-sized chunks, you know, 2 weeks is a good way to do that. And you can plan your life pretty reasonably within 2 weeks chunks as well. So when you sit down and you say, you know, what are we going to do over the long weekend, or how are we going to do our back-to-school shopping, that sort of thing, within the next 2 weeks, you can go to public health, you can look at the COVID-wise supports that are there and say, well, if we're going to do this, we need to do it in such a way that not all the family goes necessarily to the store, or that we do it in such a way to make sure everybody has masks, things like that. So it's really to take what is quite a significant challenge in everybody's life and try and turn it into a bite-sized chunk to deal with it.
Thank you very much.
Merci, merci pour les questions, Julien. Now we'll move to on the city from the burbs. Do we have Sue Sharing now? Okay, I'll call that out again at the end of the list. So we'll move on to the next one, the Ottawa Citizen.
Hi there, it's Aidan Helmer with The Citizen.
Go ahead, Aidan.
Yes, a question for Dr. Etches. Just on some of the reports recently of some longer than usual lineups at the testing centers, both in the West End and at Brewer. I'm just wondering, in some cases we're seeing lineups that are 3 to 4 hours. I'm just wondering if you've been tracking sort of a surge in numbers of people that are getting tested, and perhaps you could talk about maybe what some of the factors might be that are affecting those numbers, whether it's in response to a spike in cases or due to some of the requirements from retirement homes requiring visitors to be tested first. And is there any concern maybe that the lineups might work to discourage people from actually getting tested? Just hoping you could speak to that.
Yes, thank you for the question. I will back up a little bit to say that absolutely the demand for testing has grown repeatedly over the course of this pandemic with the change in different policies, from the provincial government, and the capacity that is there to offer testing to the population. So we had a jump in the demand and the volume that needed to be addressed through testing at assessment centers when there were requirements about testing before visiting in retirement homes and long-term care. However, that requirement is now only for indoor visits. It isn't required for outdoor visits anymore. So that should help. The volume has continued to go up over these last couple of weeks, really, and significantly. So I want to give our hospital partners who run the testing service credit. They are adding capacity. Absolutely. They just aren't keeping up because the demand keeps growing. And I know they're working hard. They have been making efficiencies, constantly looking at how they can serve more people. They have been hiring staff, and they are looking at other options for different ways of doing things. So the plan for testing is going to shift. It's going to be more, uh, you know, a strategy that works for the long run. Right, so the long wait times outside is not sustainable. That will change. The other thing that we're seeing is this concept I mentioned in my statement today, that is asymptomatic people thinking, maybe I'll just get a COVID test and then I can be negative and tell people, or I'm negative, and then we can kind of relax. And that testing isn't recommended. It is driving some volume at the centers that is not recommended. We need to keep the capacity for people who have symptoms. If you are sick with a mild flu-like illness, you're one of those people that we want to prioritize through the testing lineups, and as well as the people who are close contacts with cases. So this is the focus. This is what we're advising our partners who run the systems to make sure that they are building these ways to prioritize the testing that's most important. And they're working hard to try to improve the situation.
Okay, wonderful. Just as a follow-up, if I may. Yeah, just as a follow-up, if I may. Thank you very much, Doctor, for that. You mentioned that, first of all, there is a need for this method to change, that it's just not sustainable to have people outside. I'm just wondering, and you also mentioned that some of the increases have happened after these policy changes. We do have one major policy change happening in September, obviously with back to school. A lot of other reporters have mentioned. Just wondering if you anticipate another surge in numbers for testing, as a result of that policy change, and if there needs to be either an increased testing capacity by the fall, or if those changes that you have mentioned need to be implemented by the time that we all head back to school.
So what we've learned so far with a lot of the testing that's been done, the testing of asymptomatic people, is that when there's no illness evident in a population, like a long-term care home staff that's not sick, we don't find COVID. We just don't find COVID. And yet when there's a case of COVID confirmed, and we do more testing around that case, we find more cases that are asymptomatic. So that the best use of our testing is to test once a case is identified around that case, or in an outbreak setting, broadly in an outbreak setting, to help control the outbreak. So I don't see any need for parents, youth to all try and go get testing before school starts. That would be problematic. It's not warranted. It has the same problems with thinking you could get tested before you socialize, and that's okay. The negative doesn't give a guarantee. And what's actually important is making sure you stay home when you're sick, because it's the people who are ill that are more likely to spread the virus. So we do need testing capacity for students and youth, and teachers and workers when there's a case identified in a school. And so that is part of the renewed, the improved testing approach will include the capacity to respond to schools in a timely way, to make that access easy for those who need it, related to a school environment.
Thank you so much, Aidan. Some great questions there. Moving on to the Ottawa Sun. Who do we have from the Sun?
Hey, it's Taylor.
Go ahead.
I actually want to follow up on my colleague's questions with what Aidan was asking. I know, Dr. Etches, you mentioned that, what we're seeing right now, these hours long waits outside of the assessment centers, they're just not sustainable. This will change. Can you give any more detail about what that might look like, and kind of when we can expect to see that change starting?
I feel a bit out of my lane in terms of speaking to how the assessment centers are being run and the plans for specific services, because I'm not managing those services. But I am aware. I'm in talking to our partners about the plans and try to influence, making sure we have the capacity for what we need. The ideas that I would expect you will see soon include additional sites, appointment-based processes, looking to have really dedicated staff. Keep in mind, the hospitals had to run these assessment centers. They set them up in 2 days. They had to run them with staff they could find from redeployment, from usual operations, and now these staff are back working in hospitals. So it's a whole transition to a more sustainable testing strategy. Ontario Health is the body that's overseeing this, and I know that. That they're looking to invest in these longer term strategies very soon.
Thanks for your question, Taylor. Do you have a follow-up to that?
I do. Thanks so much. I'm wondering how the pandemic is actually impacting Ottawa Public Health's ability to fulfill the non-COVID aspects of its mandate, and if you are looking for any additional resources, and what you hope those would look like, if so.
Thank you. Ottawa Public Health, as an organization, we're concerned about some of the services that we've had to cut back. Because we know there's direct impact on the health of the population. I can give you examples about, for instance, the dental services and clinics we run. They typically keep people out of emergency departments on a day-by-day basis, and we've had to cut back. Our sexual health services, we've had to be very innovative and shift how we do things, more virtual screening. And we're actually the first health unit in the country to offer mail-in HIV tests. So now people can, through a pinprick, provide their own HIV test to us by mail. So, we're trying to innovate and provide services in new ways, but we've missed school-based immunization programs for meningitis. And we need more capacity to be able to catch up on some of these core services. We can't do the COVID response and all of these other core programming without more investment. So my board chair is on the media availability with me, and we'll be having chats as a Board of Health about the kind of resources that we need to sustain the COVID response and ensure that the public's health is protected. It's maybe a bit more complicated to get into, but I think that sometimes we focus on case and contact management, the infectious disease programming and resources that we need, but it's actually the health promotion work that prevents infection in the first place that is really core and critical to keep the pandemic under control. So that the health communications, but also the work with leaders in the community, adapting to different, languages and cultures, and understanding the barriers that people face on the ground to be able to stay home when they're sick, to be able to, understand what it means to gather more safely. There's a lot of work that will be important to continue, and so. We're taking a look at this for the next year in terms of how we do a bit more of the core service while we respond.
Yeah, Taylor, thank you for the question. It's a very relevant one right now. In fact, Dr. Etches and I were chatting about that just this morning. Public health has a basic job that we do, which is health promotion. And a lot of our resources in that regard have been sucked away or diverted to the COVID response. So COVID doesn't appear to be going away anytime soon. So it's a discussion that we are going to be having in a more robust way in coming weeks as we enter into the fall, as we enter into the budget process, to make sure that the other very important pieces of work that we do and that we're expected to do by the residents of Ottawa and by the province, that we're able to continue to do that. So thank you for raising that. And again, we will be focusing more on that as we get closer into the fall, into the budget process.
All right, thank you. Thank you for that added piece. Thank you, Taylor, for your questions. Maintenant, nous allons à Radio-Canada. Je crois que c'est Stéphanie Allard.
Oui, bonjour. Ma question est pour le docteur Etches. Merci. Je sais que vous avez mentionné ne pas avoir pris connaissance de tout le rapport concernant la réouverture des écoles en septembre, mais j'aimerais quand même entendre votre point de vue sur ce qui a été annoncé aujourd'hui par le gouvernement de l'Ontario pour le retour en classe en septembre, donc temps plein pour les tout petits, temps partiel pour les plus grands. Selon vous, c'est approprié ce plan?
Je n'ai pas le détail, je n'ai pas lu le rapport à ce moment. Je vais lire le rapport et continuer la discussion avec les conseils scolaires ici à Ottawa. C'est important pour les enfants d'être là dans les écoles pour l'automne, pour leur santé, leur développement et la santé de la famille. Pour l'économie et l'importance d'avoir l'emploi pour la santé de la population est vraiment une priorité. Alors, c'est bon qu'on a un plan où les étudiants vont retourner, mais les détails, on a besoin de travailler dans notre jurisdiction, d'essayer d'avoir une approche plus sécuritaire possible. Alors, on va utiliser les infirmières en santé publique, d'aider avec le processus de prévenir la COVID-19 dans les écoles et aussi d'avoir une réponse rapide quand il y a un cas. C'est vraiment important de trouver un équilibre avec COVID-19 et aussi les autres actions et services importants pour notre santé.
Merci.
Un suivi, Stéphanie?
Oui, j'aimerais vous entendre quand même sur le port du masque. Le gouvernement recommande le port du masque toute la journée à partir de la 4e année. Selon vous, c'est envisageable pour des jeunes de cet âge-là de pouvoir passer la journée avec un masque?
Auparavant, probablement, c'était trop difficile de penser à une action comme ça, mais maintenant, la culture change. On a fait un sondage concernant le parti de la population qui porte des masques à l'intérieur et auparavant, c'était 60% qui a dit oui, on porte un masque presque tout le temps ou tout le temps. Et maintenant, la proportion, c'est 97%. Et c'est clair, quand on est dans une entreprise maintenant en stage 3, c'est normal de porter un masque. C'est pas tout le monde qui peut le faire. Il y a toujours les exceptions, mais c'est la grande majorité. Et les actions que les adultes font est un modèle pour les enfants et les jeunesses. Alors, c'est quelque chose qui peut ajouter protection pour la transmission de COVID-19 dans les écoles. J'imagine que ça prend une période de temps de trouver des masques, de préparer, avoir une nouvelle action, mais j'apprécie que c'est possible.
Merci.
Merci pour tes questions, Stéphanie. Donc maintenant, nous allons passer TVA Gatineau, Ottawa. Est-ce qu'on a quelqu'un de TVA? J'en aperçois pas, mais je voulais quand même poser la question. Est-ce qu'il y a quelqu'un de TVA? OK, donc voici, ceci conclut. This concludes the media availability. So thank you for your participation. Thank you for the great questions. Merci beaucoup. Unfortunately, this is all the time we have. Thank you, Dr. Etches. Thank you, Councillor Keith Eglai for your participation as well. And a good afternoon to everybody. Merci beaucoup. Thank you.